COVID-19 has changed how we do our day-to-day activities, everything from how we grocery shop to how we work and now how we see the doctor. Reporter Ruta Olsenida has more on telehealth and why it has become so efficient in the midst of this pandemic.
The healthcare system is changing in the face of COVID-19. Virtual telehealth services are now becoming more accessible and more convenient.
So it's been a very positive thing, and our providers are loving it too.
To minimize exposure and continue service, healthcare providers and insurance companies are teaming up so that a lot of doctors' visits can be done right from home and be as simple as doing it right over the phone. CHI Health says they've been wanting to implement a telehealth system for a while, but it was tough to figure out how insurance companies would cover those visits.
But actually the greatest hurdle was in the past, before the pandemic, most insurance companies were not reimbursing for virtual visits or telehealth visits.
Now, insurance companies like Blue Cross Blue Shield Nebraska are expanding their telehealth capabilities, even waiving copays.
So if you went into your doctor's office, you might have a copay of whatever amount of money that it would be. That's going to be waived for telehealth services during this pandemic crisis.
Telehealth is a great way to check up on things like a cold, rash, or fever. Teletherapy, over-the-phone mental health services are just as useful.
Really, with the coronavirus situation, when effectively everyone is remote because we're all, or most of us, are locked away in our houses, it's really become very popular and very useful.
And medical professionals believe the pandemic sped up technology and how we utilize these services. Now, telehealth could be the way of the future.
So yes, I think it sped things up, and I am hopeful. I do believe that it's something that then will be able to continue beyond the pandemic.
Reporting in Omaha, Ruta Olsenida, 3 News Now.
While these virtual visits are great for checking out symptoms that don't need immediate assistance, those with more severe symptoms that can't be treated virtually should still visit an urgent care or emergency room.